Good afternoon, everybody. My name is Dr. Chris Bird. I'm here to give you your weekly COVID-19 pandemic report on behalf of the Coastal Bend COVID-19 Task Force. It's April 23rd, 2021. I want to remind you about our objectives on the task force. We're here solely to address your concerns and questions about COVID-19 and the interventions that are taking place, and to help to enable evidence-based decision-making. I want to apologize for us delaying the Q&A session earlier today. We had some technical difficulties that prevented us from going live. We're working those out, and we may be broadcasting the Q&A after this, so stay tuned. There are several interventions that are taking place to combat the spread of COVID-19. The primary one is the vaccine and getting vaccinated. Right now, there's a high risk of coming into contact with COVID in the general community. You can see the noasisnose.com risk dashboard to see the risk every day, but it's been orange for several weeks in a row now, which is one step below the highest level. So you're also encouraged to avoid crowds. If you are going into a crowded area, you should be wearing your face covering or coverings. If you have a cotton face covering and a surgical mask, you're encouraged to double up on that. Social distance, isolate when you're exposed or symptomatic, and we have partial to all remote schooling occurring in the Coastal Bend region. I know I've seen more and more people taking off their masks in public settings. I want to remind you that the pandemic is not over yet. COVID-19 is still in our community right now, and even if you've been vaccinated, you want to continue to wear the face coverings so that you're not essentially an experiment determining if you can be the one that contracts the version of the virus that's immune to the vaccine. Please keep wearing your face coverings until the level of COVID goes down more than it is now. We're not low enough yet. So in terms of active cases, there are 624 active confirmed cases this week. It's the same number as last week. There's been 42,752 confirmed cases and 40,868 recoveries from those confirmed cases. Now, a confirmed case is one that's determined with the nasal swab test or a PCR test, or one of the other tests combined with a physician's diagnosis of COVID-19. So the confirmed cases aren't all of the cases, they're just a portion of all of the cases. So many more people have contracted COVID in the Coastal Bend. Maybe up to 40% of the Coastal Bend has contracted COVID at this point throughout the whole pandemic. In terms of the transmission rate this week, we're right about where we were last week. There's no change in the model. The transmission rate is 0.97, which means essentially that for every person that contracts COVID, they pass it on to another person. And so that keeps COVID level and does not allow it to decline. What we'd like to see is COVID start to trail off more in the community. The way that that can happen is if we continue to take it seriously rather than trying to go back to normal. The reason why we're staying level and not continuing to drop like we were in the past, look at all this time between the new year and mid-March where we were below 1 in that transmission rate, which means COVID's declining. The reason why that's not happening anymore, despite the fact that people are getting vaccinated, is that as people are getting vaccinated, there's other people that aren't getting vaccinated that are also taking off their masks. And that is kind of keeping us at the same level. So for every person that gets vaccinated, there seems to be somebody else that decides not to wear their masks anymore, and that's what's keeping COVID going right now. Right now, in terms of the daily confirmed cases, we're right around where we were in the fall. After the big summer peak, and now we've had our fall and winter peak, and now we're in the springtime. The projection has the level of COVID staying about the same if we continue the way that we have been right now, which it's lower than it has been, which is good, but it's not down at zeros. A year ago, just to remind you, about a year ago, we were coming off the spike from the meatpacking plants. and from the other transitional housing facilities. And from that point forward to Memorial Day, we kind of stayed at pretty low levels a year ago. And so looking at this year, we might expect that we'll keep this level track. And then maybe around Memorial Day and into June, things could change. So when we break down the number of new cases per day by age class, and this is just for Nueces, we only have this data for Nueces County, what you can see is that while last week the overall trend, which was probably out to here, looked like a declining trend for pretty much all the age classes, this week there's been some increases, and you can see that there's increases in the number of cases per day in 0 to 17-year-olds. 18 to 39-year-olds, slightly declining to staying level. 40 to 64-year-olds, staying level to slightly increasing, and then staying approximately level for people above the age of 65. So we are seeing a little bit of spreading of COVID in the young people in our community. When we look at the counties, what you'll see is that Nueces has been relatively level to slightly declining in the past week, but right around here, 25 new confirmed cases per day, versus in the rest of the coastal bend, we've seen quite a few other counties experiencing a marked increase. And we can zoom in on this. So these are only the coastal bend counties that don't include Nueces. So San Patricio at the highest level, Clayburgh increased a little bit less. Duval and Jim Wells is right here at around 2 new cases per day. Aransas is increasing, Refugio is increasing, B County is increasing, and Brooks is staying about level. So we haven't been able to, I haven't seen a trend like this in the surrounding coastal bend counties in a little while. So we're bringing this to your attention now. It's only been for about a week that this trend has developed. So sometimes these increases, they come and go. You can see here for San Patricio, there was a blip upwards followed by a downwards trend. We'll see what happens here moving forward. But if this continues moving upwards next week, by next Friday, then I think there would be a little bit of reason for concern. All right, going to the South Texas metro areas, you can see that there are three counties in the South Texas region, Victoria, Brownsville, and San Antonio, that are all experiencing an uptick in COVID cases. McAllen continues to trend downwards, while the other counties are staying approximately the same and level. Here's the whole state broken up by public health regions. We are in South Texas, here, this gold area. And if you look through the spaghetti of different lines there, you can see that South Texas overall is just slightly decreasing. San Antonio and that public health region is increasing fairly markedly over the past couple weeks. And then El Paso about level, and most of the other parts of the state are right about level. Okay, so coming back into the coastal bend and hospitalizations, I've updated the model this week. If you've been following us, I've been showing a pattern where since about the end of January, the model projected number of hospitalizations was below the actual observed number of people in the hospital with COVID. And so I had to increase the hospitalization rate to get it to fit. And now what that means is that the hospitals could have lowered the bar for who's admitted with COVID, but it is also probably partially reflective of the new COVID variants, now not so new, but newer COVID variants that we know are spreading around the country and come along with increased virulence, which means that you'll get sicker if you get infected with one of these newer variants than if you got infected with one of the older variants. And so those two factors combined are resulting in this new projection. And so what we see is for the people in the hospital with COVID, it's staying approximately level. If you look at a longer time period, it's still declining slightly. Our projection is to have it continue to stay level to declining slightly if everything continues the way that it has been. Looking at the ICU, and we're really concerned about the ICU because this is where our healthcare system feels the COVID pinch first. And right now, it's not feeling that much of a COVID pinch. You can see there's 22 COVID patients in the ICU right now and 132 non-COVID patients before the big outbreak in June and July of last year, which kicked off right around Memorial Day 2020. There was approximately 148 people on average day to day in the ICU that didn't have COVID. I would say right now we're in the range where people who need ICU care can get it. And that's what we want to keep it. That this is the way that we want to keep it, so that if somebody needs intensive care that doesn't have COVID, they can get it, and they're not getting swamped out by, excuse me, a number of people with COVID like we saw here in July of 2020, where we had as many people or more people with COVID in the ICU than we would normally see patients in the ICU, period. Okay, this graph is a single day. It's April 22nd, which is yesterday, for the whole Coastal Bend. This is the ICUs again, and the red is COVID. The more red you see, the more strain there is on the ICUs in the different parts of Texas due to COVID. The more blue you see, the less strain there is. I believe I can say that we haven't seen these skies so blue since we started showing this figure. So it's a very low level of strain on the ICUs right now across the state due to COVID. This is good. We want to keep it that way. All right, moving on to fatalities, the weekly fatality rate, and what that means, or weekly number of fatalities. Each one of these points represents the sum total of fatalities in the previous 7 days. I like this figure because there's a lot less variance in it than the daily fatalities, which you can see here. You see how spread out those data points are when you count the fatalities day by day versus when you count them week by week or the previous 7 days. You can get a better fit. So here you see the model fit to that data, and the projection is that we're leveling off, and we expect that the fatalities will continue, unfortunately, due to COVID-19. Here it is in the daily view, same projection. So we're right around 1 fatality per day in the Coastal Bend. In total, there's been 1,260 fatalities due to COVID-19 in the Coastal Bend. If you look at this trend, you can see that this is the total number and it's leveling off. Part of the reason why it levels off is because death certificates are being processed from the past 14 days. But the other reason why it's leveling off is because the fatalities have declined substantially over or below what they had been at. And we're at 765 fatalities in Nueces. I want to remind you that this data that we obtain from the state is a little bit behind the data that you see in the local newspaper, the Caller Times, or you see at cctexas.com. So there might be a few more fatalities listed there. Moving on to vaccinations, looking at more of the bright spots in the pandemic. We're increasingly vaccinating the Coastal Bend population. Kennedy is leading the way with nearly between 35 and 40% of Kennedy has been vaccinated at this point. And this is among all residents, not just the elderly, not just among adults. That's 35 to 40% of all residents in Kennedy have been vaccinated. And then Live Oak is down here right around 19%. And then all the other counties are somewhere in between there, with Nueces right around 26% of the population being fully vaccinated. When we look at the whole state, we can see that 27% of the Coastal Bend has been fully vaccinated. Again, this is out of all people in the Coastal Bend, not just adults. But we're falling a little behind some of the other areas. Seven Flags, which is Laredo and the surrounding area, they are at 30% of their population fully vaccinated. The lower Rio Grande Valley, the Austin area, and El Paso and that area are all maybe pulling a little bit ahead of where we are in the Coastal Bend. I'd like to see our numbers increase a little bit more than they have been so that we can lead the state again in this category. If you're interested in how the trends in vaccines are going, we continue to see a linear increase over time, approximately from the beginning of February through the present, in the number of vaccine vaccines delivered per week. And so this is the number of people with 1 or 2 vaccine doses. So essentially, it's the number of people with at least 1 vaccine dose, and we haven't started leveling off yet. You can see last week we saw a really big increase. It was the biggest increase we'd seen in people vaccinated since, at least since the beginning of February. This week there hasn't been nearly the same increase, but there's a lot of variability in these data points through time, and there could be a new trend next week with more people getting vaccinated. But we're going to estimate that's going to continue to follow this line approximately. Right, we can break down the vaccines in the Coastal Bend into their age categories. And so the 65 to 79-year-old age group is the most vaccinated. About 76 or maybe 78% of all people 65 to 79 in the Coastal Bend have been vaccinated. For people 80 plus, it's a little bit lower. Maybe down in the upper 60%. For people 50 to 64, it's a little bit lower than that. And then it's the 16 to 49-year-old age group where we could stand to make a lot of gains in increasing the total proportion of our population that's been vaccinated. So if you're between the ages of 16 and 49, please go out, and if you're wanting to get vaccinated, go and do it. There's no time like the present. My doctor's office called me up this week and asked if I wanted to get vaccinated, so I assume that's happening for other people also. I've already been vaccinated by the public health department, so I didn't have to take advantage of that. But the public health department is running clinics at the mall, the La Palmera Mall, as well as other locations. You can go to cctexas.com to find out where the public health department is holding those clinics. And once again, if you're eligible, go out there and get vaccinated. There's no time like the present. All right, so in summary, the new cases are level to slightly increasing. If you remember, in the Coastal Bend counties that aren't Nueces, we're seeing an increase in the COVID cases across several of them. Nueces is approximately level. For hospitalizations and fatalities, they're approximately level to slightly decreasing. We'd like to see them not slightly decreasing, but majorly decreasing. The way that you could help with that is by wearing a mask when you're going out in public, even if you've been vaccinated. If we rely only on vaccinations right now to slow down COVID transmission, there can be another outbreak. There hasn't been enough of our population that's either recovered from COVID or been vaccinated to stop an outbreak from happening if we should try to go back to normal completely. So you're encouraged to stay vigilant, get vaccinated if you're eligible, wear your face coverings. We're almost done. All right. So if the more you wear your face coverings out in public, the more people that are doing that, the faster this is over. Where we're at now, it's not the best place to be. If I made a weather analogy, it's kind of like it's drizzling outside, and it's not great when it's drizzling. We'd rather it be sunny, but our behavior is causing that drizzle to continue and make raining on our parade somewhat. So we're encouraging you to do these things. Don't throw a big party right now. It's not the right time yet. And if you do this, then we can finish this sooner than later. So thank you very much for tuning in this week. I want to remind you that we welcome questions, comments, and feedback on our social media accounts on Facebook, Twitter, and Instagram. Our handle's CBCovid, pretty easy to remember, Coastal Bend COVID, CBCovid. By all means, hit us up on there. We're happy to answer your questions. We do a live Q&A every Friday at noon. Like I said, this week's Q&A hopefully will happen in the not too distant future because it didn't happen at noon, maybe at 3:30. If we're lucky, I'll have to check my text messages when this is over. So I hope everybody has a safe and enjoyable weekend, and we'll talk to you next week.